and welcome back to my channel. For those of you that are new here, my name is Tanya and I'm a second-year nurse practitioner student living and going to school in Ontario, Canada. For today's video, I thought I would share with you guys the most frequently asked questions that I have personally gotten in a nursing job interview and how I answered them. For these questions and answers, I've split them up into two categories, into personal questions and medical questions. So let's get started. I have my book here so that I don't forget what I have to say. So starting off with the first most frequently asked personal question that I have personally gotten during my nursing job interviews was, tell me a little bit about yourself. So this is where you get to shine, where you get to show your personality. And as a new grad, the way I answered this question was actually going back to my nursing school experience and what got me into the nursing program or nursing field in general, whether it was a personal experience, something that happened in my past, and my journey through nursing school. As a nurse who has worked in a previous organization, the way I would answer this question is to pull on my other nursing experiences from other organizations. So for instance, in my Get to Know Me video, you would have seen that I have been in general medicine for 7 years now. I started 3 years in Toronto, and then after that, I went to the Middle East for 2 years. So that experience is unique to me, and I like to highlight that during my job interviews. Keep in mind that during the interview process, it's not only about your personality, but it's also about eye contact, about smiling. I know pre-COVID, we didn't wear masks, but now we have to wear masks. But everything is in the eye, looking at the interviewers or the manager in the eye, and also your body posture, not being super hunched over and having your shoulders back is really important. Second most frequently asked question that I got was, tell me some of your strengths and weaknesses. So here I'd like to highlight 2 strengths and 1 weakness. Usually they don't ask more than 1 weakness. So for my strengths, I usually say my strength is organization or time management, and my other strength is communication. So I like to start off with my strengths and explain why they are my strengths. For my weaknesses, I like to highlight only 1, and this is my personal weakness that I usually carry over into all my interviews, and that is carrying the emotional baggage home. Sometimes nurses, we can get caught up emotionally with a patient or a patient's family, and we tend to bring it home with us. So that is one of my weaknesses, but at the same time, I like to address how I'm going to fix it or how I intend to solve that weakness. What I usually say to address this weakness is to engage in some form of debriefing, either with another nursing colleague, with a manager, or as a team. I find that this step is really crucial, not only identifying your weakness, but also how you're going to address it. So be prepared to demonstrate a weakness, but also address how you are going to fix that weakness. Third most frequently asked question that I usually get is, how would you solve a conflict with a colleague? Now for this question, what you always want to say is never address it in front of the patient or staff or in a public area. What I usually say is that I will take that colleague or the nurse or whoever I'm having a conflict with aside to a private room so we can both talk about it. If it's not resolved at that level, then we can escalate it to our manager. Another question that's similar to this one is, how would you deal with a nurse that you see that is not providing safe patient care? Again, you want to answer this by taking them aside, not exposing them or not talking about it in front of the patient or the family, taking them aside and letting them know what you saw and how you think it can be corrected. Again, if it's not resolved at that level between you two personally, then you can always escalate it to your manager. Fourth most frequently asked question for me was, name a time that you went above and beyond for a patient. Now here it's tricky to answer this as a new grad, but again, you can pull from your nursing experience at school. So talk about a time that you went above and beyond for a patient in your clinical or your placement setting. One of the examples I like to give is that a patient that I was working with, he was not eating for some reason, not taking his medications. And previous to this, he was taking all his medications, he was eating, but then one day we saw a slow decline of him not really interacting with us, not taking his medications. So with more questioning and more talking with the patient, we realized that he really missed fresh air. As you know, that in hospitals the windows are closed, so we're not able to open them to let the air in. So he really wanted to go out and just sit outside in the sun. This patient was wheelchair bound, so what I did one day is lift him using the Hoyer lift and put him in his wheelchair, and I took him outside for a little bit of fresh air. And he was super grateful for this. We did this a couple of times and he was almost back to how he was before. So that is an example that I like to use of how I went above and beyond for a patient. Now moving on to the medical questions, which I think a lot of nursing students and even a lot of experienced nurses get a little bit tripped up on. So the first frequently asked question that I got is, you have 3 patients. One patient is experiencing chest pain, the other person needs to go to the washroom, and the other person is having a hard time breathing. How would you deal with this situation? So here I feel like they're looking for, how are you going to multitask? And for this question in particular, I feel that this is a delegation question. So just remember that you are not alone. You are not expected to handle all of this by yourself, and the nurses or the nurse manager recognizes this. How I would answer this question, or how I have answered this question, is of course chest pain is number one. Red flags everywhere. So deal with the chest pain and delegate. Ask your nursing buddy, ask the head nurse or the charge nurse, or even ask your nurse manager. Listen, I have 3 patients right now that all need some attention. I will deal with the chest pain. Could you please check on Mr. Smith, who is having trouble breathing? Sarah, could you go and check on Mrs. Jones that needs help going to the washroom? And again, remember that nurses, we work as a team, and as a team we help each other. And this is what I feel the nurse manager really wants you to understand and appreciate. Going off of the previous question, the second question that I usually get is, how would you deal with somebody having chest pain? Or how would you differentiate somebody having chest pain versus abdominal or heartburn, GERD? And the way I like to answer this question is always triage up. Never assume that it's just heartburn or GERD. It's always good to escalate it. It's always good to ask a maybe senior nurse or even escalate it to the doctor. For more seasoned nurses, as soon as we hear chest pain, of course we go get the blood cart, we draw tropes. I like drawing all the tubes. So not only starting with tropes, but everything else, because especially if it's an elderly patient, I don't want to be poking them a lot of time. Actually, any patient, I don't think any patient wants to be poked many times. So I always know to draw blood, to do an ECG, and of course vitals. That's baseline, and then of course call the doctor. The third most frequently asked medical question that I usually get at nursing job interviews is, how would you deal with a difficult family or a difficult patient? I'm sure as nursing students or as a new grad, even experienced nurses, we have many ways or many strategies of dealing with a difficult family member or patient. So the way I like answering this question is identifying the family or the patient's needs. You always want to ask them, what is your main concern? And if I can address it at that moment, I will. I also like to have open lines of communication with the patient and the family, because sometimes they might be upset because they don't know what's going on. So a good example is a lot of my patients, especially diabetic patients who are waiting for surgery or a scope or something where they have to be NPO from the night before. The family and the patients are always worried that they might go low or have hypoglycemia. And they're always asking, when can the patient eat? Because they've been NPO since last night. When is this thing getting done? So what the families and the patients don't realize is that sometimes emergency cases come through the OR and they take priority. So I always take the time to explain to them that yes, your surgery or your procedure was scheduled at this time, but since we are in a publicly funded, or at least in Ontario, we're in a publicly funded healthcare system, people who are triaged as emergency cases will get priority. And unfortunately, that means that you will get bumped down or bumped to a later time. However, I always like to follow up with, do not worry, especially if they are diabetics. We've had many patients who unfortunately don't go at their scheduled time, but we will always check on your family member or on yourself with blood sugars, making sure that you are okay. And as soon as we know that you are not able to go to the procedure at that same day, we will let you know. And that's usually around 3 or 4 p.m. If they haven't gone down around that time, chances are that they're not going that day. Another case scenario that I like to give is maybe a patient's family does not want the patient to be turned. They look comfortable, they're already tucked in bed. However, I like to take this time to educate them on the importance of turning and repositioning, especially when it comes to pressure ulcers. A lot of people who are not nurses or who are not in the medical field don't really understand the concept of pressure ulcers, and especially with the older population. So here again, keep the lines of communication open between patients and family members and yourself, and explain why you want to reposition them and the importance of it. This works for me almost all the time. The patients' families are very grateful because they've never really understood what pressure ulcers mean, and they're really grateful for the time, even 1 or 2 minutes that you take to explain it to them. And finally, the last question that I usually get is, how would you bring in a food tray for an isolated patient? And of course, the answer to this is always wear full PPE. Whatever is described on the sign of the patient's door, that's how you want to go in. Even if you're just checking on them for 5 seconds, bringing in a food tray, going in for an hour, whatever the time is, you always want to wear full PPE. That's a no-brainer, and that's always a given. General tips that I want to give you guys in terms of the interview process is, of course, showing your personality, being confident. And being confident also means that you know what your limitations are. And I'm not talking about weaknesses, but I'm talking about things that you don't know. It's okay to not know things. Whether you've been a nurse for a year or 10 years, we're always learning something. I'm always learning something every day when I go to work. It's about knowing your limitations, knowing that you don't know everything, but you're willing to learn or you're willing to find out. So there's always a bunch of resources on the floor. There are people that you can use as resources, senior nurses, your nursing educators, your manager. Another tip is to take your time to answer the questions thoughtfully and carefully. It's okay to say, give me a minute, I'm not really sure about this question, and just collect yourself, think about it. I know for new grads, especially going into your first interview, it can be really nerve-wracking, but it's okay to take some time. My final tip, and probably my biggest recommendation, is to try to hand in your resume in person. I know with the pandemic it's really hard and we're trying to avoid as much contact as possible. But if you can, if you are able to drop it off in person, do so, because that's how I landed my first nursing job. I remember I was in my last year or my 4th year placement, and I heard that they were hiring on a unit that I wanted to go to. So what I did is I printed my resume and I went downstairs, or it was a floor down, and I handed in my resume in person. The feedback that I got from the manager after I had been hired, she said that I was the only one that came in person to hand in the resume, and that's what really stuck with her. Those are all the questions and answers that I personally remember from all my nursing job interviews. I hope the questions and answers and the tips I gave you help you land your dream job or your next nursing job. Please let me know in the comments section down below what videos you'd like to see, what topics you want to see covered, whether it's nursing related or nurse practitioner school related. I made this channel for you guys, so I will continue making videos, but I would really appreciate your feedback. And I will see you in the next video.